Good morning, one and all. Seeking the blessings, I, Dr. Rashmi, Senior Assistant, on behalf of the Department of Community Medicine, JSS Medical College, JSS AHR, extend a warm welcome to all those gathered here today for the webinar on the occasion of World Breastfeeding Week 2024 with the theme Closing the Gap, Breastfeeding Support for All. We begin today's program with a launch of our YouTube channel, Chetana, that stands for Community Health and Education, Training and Awareness Promotion, Networking for Action from the Department of Community Medicine. I request our beloved principal, Dr. H. Basavangowda Pasar, Vice Principals, Dr. Suma M. and Dr. Praveen Kulkarni, and Professor and Head of the Department of Community Medicine, Dr. Sunil Kumar D., to launch our YouTube channel by unveiling the digital curtain.
Come, all of you come. Extremely happy to launch this YouTube channel on Chetana, basically created by Department of Community Medicine for creating more awareness about breastfeeding and its usefulness. And I thank all those who are joining to create this awareness intensified through the webinar. I wish the program all the best and hope this channel will be reaching many in the society to create awareness about the values of and importance of breastfeeding. Thank you. All the best.
Thank you all. This is the QR code. We can scan through the QR code, and below is the given link available through which, on clicking on which, we'll be entering to the YouTube channel. That is Chetana. Please subscribe and watch our YouTube channel for regular updates and interesting health topics. I thank Dr. Basavangowda Pasar for gracing this occasion on his busy schedule. I request Dr. Sunil Kumar. I thank Dr. Sumama for gracing this occasion and making this a successful program. Thank you. I thank Praveen sir for gracing this occasion and helping in the service.
Thank you. All the best. Go on.
Thank you, sir.
Thank you. Okay.
All the best for all of you. Congratulations.
Thank you.
Congratulations.
Thanks. Share. Share.
Moving on to the sessions of today, we have eminent speakers who will take us through the journey of breastfeeding, through their experiences, and we'll be enlightened on importance of breastfeeding, difficulties encountered in special needs, and breastfeeding in special groups. Now, I request Dr. Amoga Shri to introduce our first speaker of the day, Dr. Sushma K.
Good morning. Dr. Sushma Krishnegowda. Ma'am is an associate professor at NSU, Department of Pediatrics, JSS Medical College. She has completed her MBBS from Sri Devaraja Aras Medical College, Kolara, and she earned MD in Pediatrics from Kempegowda Institute of Medical Science and Fellowship in Neonatology from KR Hospital, Bengaluru. She has publications of 22 till date, and her area of interest includes preterm newborn and neonatal resuscitation. She served as a national instructor for both basic and advanced neonatal resuscitation. She was also a part of team in developing an app, Shishu, in association with National Neonatology Forum. She has been actively involved in vaccine trials and academic projects in NSU. She also has 3 patents to her credit. Over to you, ma'am.
Thank you, Amagushri. Am I audible? Yes, ma'am.
Yes, ma'am.
Yeah. Thank you, Amagushri. At the outset, I would like to congratulate Dr. Sunil Kumar and his team for the excellent launch of the YouTube channel Chetana. I think that this was the right time for the launch regarding, especially with the breastfeeding week going on. And I also thank the Department of Pediatrics for giving me this opportunity to speak on the topic breastfeeding, which is quite close and we are closely associated with in day-to-day life and day-to-day management of the babies. As we all know, this year's theme is closing the gap, breastfeeding for all. This week, especially August 1st and 7th, we have been doing this breastfeeding week. This is basically a profound reminder for us regarding the importance of the breastfeeding, which is a fundamental aspect of the maternal and the child health. And this deserves constant support and recognition. The idea behind celebrating this breastfeeding week is to recognize and celebrate the breastfeeding. I, Dr. Sushma, would like, in my presentation in the next 20-25 minutes, will briefly speak about the breastfeeding week, how this initiated, how this started off, what are the main objectives and goals of the breastfeeding, a little bit of physiology to understand the basics of breastfeeding, colostrum, hind milk, certain aspects of breastfeeding, which all of us speak about whenever we take the topic, and myths and benefits of breastfeeding. And at the most, we come back to our main theme, that is, what are the challenges we are facing in day-to-day life. Lot of things we face theoretically and lot of things we face practically also. And what are the strategies we can do to overcome these challenges or gaps we are facing in breastfeeding? And at the last, I would like to share few experiences of my own, what I've been doing for the last 15 years, and what are our hospital strategies we are doing to encourage breastfeeding. We know that breastfeeding week is called from 1st to 7th August of every year. But yes, August is also declared as the breastfeeding month by the United States of America. In 1990, when the WHO initiated, a few policymakers and decision makers, they took a challenge that the main target of achieving 50% of the mothers to encourage breastfeeding in 2025. This was their main target. And to achieve this target, in 1990, there was some meeting of the policy makers in Italy, in Florence, in Sonte, where they conducted a meeting and they decided they're going to celebrate 1 week for every year, so that it is a constant reminder and encouragement and reinforcement regarding the breastfeeding to achieve the goal. And since this was held in 29th through 31st of July, they decided the following week, that is the August 1st to 7th of every year will be celebrated as the breastfeeding week. And that's how the breastfeeding week being celebrated in that particular time came into effect. Once these policy makers decided about taking the breastfeeding week ahead, there was one more organization they created where the global network of individuals and the organizations came into picture in 1 year, that is in 1991, called as the World Alliance for Breastfeeding Action. Here, this organization was a group of individuals who were dedicated to the protection, promotion, and support of the breastfeeding. Following that, every year they started encouraging the mothers, and by 1993, this group encouraged the mother-friendly workplace initiative. They started to get in more and more support for the working breastfeeding women. Although not completely implemented, yes, that was the starting point where they initiated for the working women. In 1996, they then extended into from the breastfeeding alone, they extended into the Forum of Children's Health and the Children's Rights also. The main idea of starting breastfeeding, attaining the 50% goal of attaining the breastfeeding was to reduce the neonatal mortality and also the morbidity. So to achieve that long-term impact of the breastfeeding, they had to initiate the importance of breastfeeding here. So the main objective of this WABA was the global campaign was to raise the awareness and to galvanize the action on the themes related to breastfeeding. So this WABA, what they did was like they created or they informed about the theme of every year. Every year they pitched in and they formed a theme with the main target in mind. Okay, and surrounding that, they started encouraging all the local organizations so that has a greater impact on the public also. And to encourage this, they gave a strong support from all the organizations from this particular WHO to facilitate all the theme which was decided for that particular year. So ultimately, the WHO recommendation was the early initiation of breastfeeding within 1 hour of birth. Yes, this has got scientific logic behind deciding 1 hour, half an hour to 1 hour of birth. We'll come back slowly. Exclusive breastfeeding for the first 6 months of life. Continued breastfeeding for 2 years of age or beyond with the introduction of nutritionally adequate and safe complementary food at the right time, that is at 6 months of life. So this was the WHO recommendation, and to follow these recommendations, a lot of initiatives were taken and initiated by the public. Let's talk about why we are so much worried about breastfeeding, what exactly breastfeeding is, why mothers are having all these challenges, and what are the challenges we are facing in day-to-day life. Breastfeeding is one of the most effective ways to ensure child health and the survival. Globally, there is around 48% of the mothers ensure breastfeeding, whereas in South Asia, only 39% have early initiation of breastfeeding, that is as per the WHO recommendation within 1 hour. 69% have initiated the breastfeeding within 48 hours, and only half of them, that is 59%, continue breastfeeding beyond 6 months. That is because of various reasons. A little bit of physiology, I will not go too much in depth. When we tell lactogenesis, it is basically development of the milk secretion in the mother. So it starts right from the late preterm by 35 to 37 weeks in the mother. The mother's breast structure start changing itself. The nature start adapting itself to prepare the mother for the milk secretion. Yes, but secretion does not happen because placenta has got high dose of progesterone, which inhibits the milk secretion. Once the baby is delivered, placenta is removed. There is no inhibition there, and the baby sucks the mother's breast. The stimulation of both anterior and posterior pituitary gland to secrete certain hormones. The anterior pituitary gland secretes the prolactin hormone, which stimulates the breast alveoli to secrete the milk. And at the same time, oxytocin, which is released by the posterior pituitary gland, it stimulates the breast alveoli to eject the milk into the mouth once the baby suckles the breast. So the importance of this is the suckling is very, very important. Many times we face these problems that the mothers complain the mother does not have milk. Yes, unless and until there is strong stimulus of suckling which is happening there is no impulses which is transmitted and the hormones are not produced and thereby milk is also not produced. Positioning and latch on are the two terms. Whenever we speak about breastfeeding, these two terms have to be got into picture. There is no ideal positioning as such. The best position is where both mother and baby are comfortable and happy in feeding. Few positions we facilitate for the mothers so that they become comfortable. That is cradle position, cross cradle position, football hold position, laid back or side laying position. Good latch on is also very, very important. These things, positioning, latch on, is very important in sustaining the breastfeeding. When we tell good latching, it is basically the baby's mouth is totally pouted with the upper lip everted upwards and lower lip everted downwards. The baby's abdomen touches the mother's abdomen and we can see the suckling movements of the baby. Once there is poor latching, like as shown in the figure down, the poor latching where the baby suckles only the nipple, most of the time what happens is the mother develops sore nipple, which is very painful condition, and invariably the mother reduces the breast milk and invariably the breastfeeding becomes a failure. So these are the things which can be rectified and which can be where the mother can be educated and counseled upon, and that's how the sustainability of the breastfeeding happens. Coming to the type of the breast milk, we have two important things here. Colostrum, which is produced within 1 to 2 days of life. It is the first milk secreted by the mother, which is usually yellowish and very thick in consistency and very low volume. Initially, the baby's stomach is also very small. When the suckling improves, the baby's stomach also starts getting expanded. So most of the time, even that small volume is more than sufficient for the baby to sustain. But remember, this is a very high nutritional rich in nature. It has got immune factors, which is rich in IgA and lactoferrin, which in turn protects the baby in the GI infections and also helps in the brain development. It promotes the digestion of the baby. And again, it is a low volume milk, but it has got very high impact. Following the colostrum on the 3rd to 4th day, we have something known as the milk secretion starts completely. The initial part of the initial part of the feeding session, there's something called as the foremilk. This foremilk is very rich in proteins. It is watery in consistency. Basically, it quenches the thirst of the baby. Whereas in the milk which is produced towards the end of the feeding session, that is called as the hind milk. This is basically fat rich. It aids in the absorption of the fat soluble vitamins. It provides satiety and aids in the weight gain. So most of the time, we suggest the mothers to complete the feeding sessions completely. So the baby gets both the foremilk and the hind milk so that it quenches the thirst. At the same time, the baby should also have satisfaction at the end of the session of breastfeeding. Coming to that, what are the benefits of breastfeeding? Breastfeeding, again, it is economical, very easily available. You don't have to check for the temperature. Temperature is in the right temperature always. Breast milk has got all the nutrients which the baby needs. It has high in immunological properties, hence protection against respiratory and gastrointestinal infections. Very easily digestible. and it improves the brain development. The substances which are present in the breast milk improves the brain development of the child. Whereas for the mother, it is more of bonding between the mother and the baby improves. It reduces the risk of ovarian and the breast cancer in the mother. After learning all these things, let's slowly get back to our theme, which is there. Before getting back to our theme, there are a lot of myths around the breast milk which is present. And it depends on the each region, especially in our region, in the Mysore region. Few day-to-day problems we face every day is, first thing, many grandmothers especially, they discard the first milk, that is the cholesterol. In spite of it being a high impact milk, well, cholesterol is always considered bad milk. That is because it is yellowish. Most of the mothers will have orangish color. They consider it as a bad milk because it's not white, and it is also called as the witch milk many times. So many of them discard in spite of the mothers are encouraged to discard it. This is where the health providers pitch in into action. The second myth we have is prelactal feeds. That is, all the mothers or many mothers or grandmothers, it has been come through generations where they have told that instead of cholesterol, they give the baby sugar water or the honey water. Yes, there is a problem with honey. We have seen botulinum poisoning. We have seen babies coming up with botulinum poisoning. And with one sugar water is given, the latching on becomes very, very, very difficult. The other thing is whenever the mothers are asked to feed, the mothers have been told to feed by their adults. They have been told to feed on both the sides each time. Yes, that is the biggest myth because as we discussed, whenever the mother feeds on both the sides, she feeds half on one side, half on the other side. So what happens? The baby gets only the fore milk. So the baby does not get hind milk and therefore weight gain is not there at all. Coming down to the mother side, mother also faces a lot of things because of this. The main logic is they do not want the mother to put on more weight. So the mother has been advised not to drink much water. But please remember, unless and until the mother is nutritionally well and she is well hydrated, then the mother cannot produce adequate breast milk. And at the same time, mother has also been advised to not to take any vegetables or fruits, and she's advised to take only bland. These are the common things which we face and which the adults or the ancestors advise, which has come through generations. And yes, somewhere the cycle has to be broken. And we have been constantly reminding them and constantly telling them. The mothers, most of them are in a situation where they cannot go against their ancestors. So I think the best part is counseling the grandparents and the ancestors which are there. And slowly we are coming around with these myths. Once we know that in spite of telling so much benefits, having so much benefits in breastfeeding, all the important factors which are involved in the breastfeeding, there are a lot of challenges or gaps we do see with sometimes with the myths, sometimes with the social economic factors involved, sometimes with the social stigmas involved. And I think these are the challenges which we need to look upon. The main challenge we face everywhere is lack of education. Yes, unless and until a mother is aware about the importance of cholesterol, the importance of the hind milk, it's very difficult to convince them to give the breast milk. Once she's aware of it, once she's aware how it impacts the baby, then probably it will be easier to counsel her for breastfeeding. The lower income or nutritionally deprived, a nutritionally deprived mother will still secrete milk, which is again nutritionally less. So it is our duty to advise the mother to take proper nutrition and no access to lactation consultants. Lactation consultant need not be a doctor. She can be a nursing personnel, she can be a trained dai, or she can be an Anganwadi worker also. But the only requirement is she needs to be well trained about this. So there is, as long if there is a lactation consultant for every few people, then definitely it will be easy. So hardly any lactation consultants are available, and there is no easy accessible to these consultants. The other gaps we found is there is no support in the workplace. Coming down, we'll come back later to what support we are expecting. Modern life pressure, that is, the mothers are, because of financial problems or any other problems, they have to return back to the work at the earliest. And again, for the mother, balancing both family and the work responsibilities become a huge mental stress, which is again an inhibitory factor for breastfeeding. Lot of cultural belief and workplaces we have seen many mothers hesitate to feed in the public. They feel feeding in the public is a big social stigma. We still have, even today, we still have a lot of mothers coming to us. In spite of mother having a lot of milk, she asks us at the end of the day when we are discharging the baby, she asks us, can you give us a substitute for the milk? When we ask why do you need, the first thing she tells is like, no, as long as I'm there at home, I can feed the baby. But when I'm going out, I need to have some substitute. I can't feed in public. So that is how our mentality or our perspective about breastfeeding is in the society. In this society, we need to change the perspective of all the men, women, or surrounding people so that the mothers are more and more comfortable to feed in the public. Some communities, yes, some communities do lack the proper healthcare access. So mothers do not, as a lack of education or lack of resources, they are not aware of it. And because of the healthcare problems, they cannot continue feeding, or there is no constant support or guidance regarding the breastfeeding for the mother. As I mentioned, workplace challenges, which is predominantly seen now as we see more and more mothers coming out to work. No adequate maternal leave. Yes, a lot of organizations have come up with giving up the maternal leave, and still we see some organizations not implemented completely. Although the government has given 6 months maternity leave, many times it is not implemented completely. There is no proper place to breastfeeding. In some institutions, although they can carry, there is no proper place where she can comfortably feed the baby. Yes, few organizations have now come up with the creches where the mother can leave the baby there. She can go back and feed the baby every 2 hours once. That is the initiative which is started. And if that is implemented everywhere, that would be the best. There's no breaks between the work. That means to tell that the mothers are not given certain considerations, that she needs to take little bit of rest and she needs to take break in between the works, which is not considered. So no private place to pump the breast milk. Although whenever we see or whenever we counsel a working mother, we encourage her to pump her breast milk, not to discard it. But many mothers hesitate, telling that there is no proper place. And unfortunately, a mother even mentioned that she's going to breast pump her milk, pump her breast milk normally in the office when she goes to the washroom, which is a very sad. These being the challenges or the gaps we have seen, as aptly said, a problem defined is a problem half solved. Unless and until we know the problem, it is very difficult to give a solution for it. So now that we know the challenges, now that we know what are the gaps, probable gaps which are there, it is the time we come up with solutions for these gaps or challenges. And that is the aim of today's, this year's theme of breastfeeding, that is closing the gap and support for all. So we're coming up to the strategies. The strategies are multifaceted, not a single thing where we can be given one single solution. So a lot of changes need to be happened. First of all, there can be certain policy changes where maternity leave is implemented, whatever is there is implemented completely. There can be an extended maternity leave if mother is having issues or she wants to continue breastfeeding. A proper place to breastfeed or pump her feeds in the workplace, adequate lactation support system. That means to tell that more and more people who are interested in the teaching or spreading the word about the breastfeeding, who have passion towards the breastfeeding, need to be officially trained adequately, and they need to be used as a lactation support system. Most of the time in the communities, it is always to better pick one person in the community so that the mothers who talk to them, they're more comfortable speaking to the lactation consultant. And yes, once they are available, access to them also should be made more freely. Community-wise, I think community medicine department, Dr. Renuka will touch upon that. Let me just brief you. Programs to provide education and resources pertain to that particular population, especially, and we need to target each population in a different way. Forming a peer support group, that is an excellent thing which we can do. All the mothers or would-be mothers can form a group where they can get together in a particular time of the day. They sit back, they come out of their what all anxiety they have, what are the problems they're facing. Probably one mother can give a solution to the other, and that's how the peer support group helps. And remember, this is the best method which we can do, because only a mother can understand another mother's problem. Partnership with the local organizations to go in depth into the community. Local organizations is very, very necessary, where partnership can be done with them, and then the education and resources can be spread through them. Hospital, yes, constant and consistent support. Every hospital need to have a lactation nurse or a lactation consultant, where a constant support is given, and breastfeeding support cannot be done in one day. So it is a consistent support they need to give. Last but not the least, most underdiagnosed or under-recognized condition for the challenges in breastfeeding is the mental health of the mother. That is, most of the mothers undergo postpartum depression, maybe in different severity. Some might have very mild or very minimal, where it might not come into the picture. But some have so severe postpartum depression that we have seen mothers who refuse to take the baby in our hands. Yes, this also can be overcome by basic counseling for the mothers. Only thing, we need to recognize that and allow the mother to continue the counseling, and gradually she'll come back for breastfeeding. All the strategies are there. The next question is, who is going to do all this? Yes, there's no one person. It is a combined and a shared responsibility of the families, communities, healthcare workers, policymakers. All of us play a big role in sharing these responsibilities. So how can we do that? Mainly by investing in policy which supports the breastfeeding. So making a policy in each hospital or each region is different. So what is the best to achieve the target? How best you can do? We can implement the policy, and according to that, we can invest in that policy and implement the same. The strict implementation and monitoring for the family-friendly workplace policies, that as we told that a specific place for the mother and some concentration in the work, access to good quality child care, and also breastfeeding counseling in the remote areas, easy access for them in the remote areas. So this is how we can pitch in. Yes, technology is the one which we can access even in the remote areas. With such a widespread access, the one thing which can spread even to the remote areas is through technology. Media coverage can be of a major help in helping us to initiate these policies. Not only during the breastfeeding week, every now and then, if the media keeps talking about breastfeeding, it will be a constant reminder, and thus the mothers also, it will be more and more, and it becomes a common norm rather than a private issue of the mobile apps. There are various apps, and most of them, even in the remote areas or the villages, most of them do have some kind of smartphones. If not everyone, at least one or two people, like the lactation nurses, can carry the mobile apps, where in the app they can discuss about the problems. The mothers can put forward their problems and see what are the solution for it. And many times, if the mother may not like discussing with any person in this one, she can just write it up in the app and discuss about her own problems. Telehealth consultation is one of the in thing now, where a lot of mothers are making use of it. There usually how it is done is in hospitals there is a telehealth consultations can happen. A group is formed in the villages where the Anganwadi worker or peripheral health center people, main person involved in them. Usually they come there for BCG or other vaccination on particular days. On those days, they fix a time and those mothers ask all their queries, all their questions. Most of them have these doubts because we tell one thing, the ancestors tell the totally different thing. So that confusion is there most of the time, which is clarified during the telehealth consultation. Online support groups, as I told you, peer support groups also vary this one. If they are not there, then online support, lot of online support groups are there where each person if some person can tell something, the other person can give a this solution for it and by experience, and that would be the best. Way forward, yes, milk back is the next way forward, which is going ahead in breastfeeding. I'll talk to you about the milk back in next few slides. Let's talk about our own hospital, Jesus Hospital. What are the strategies in the hospital? For the last 14 years, I've been a neonatologist here, and we are looking after both the postnatal ward and the NICU, where we have preterm babies, where we are having talking to the mothers every day in and day out. The breastfeeding we have implemented very strongly, the breastfeeding being initiated within 1 hour and within half an hour to 1 hour of birth. And let me tell you, rather than me as a neonatologist, it is a big clap for the staff nurses, especially in the post-op, where they're very aggressive, whatever said and done, they initiate the breastfeeding within half an hour to 1 hour. Yes, there is a scientific logic, which I will be coming up in the next slide. No prelactal feeds strictly. So all the nurses are encourage the mothers to feed, and they encourage them not to give any feeds, and they tell them about the importance of cholesterol. We do not target one particular nurse. Yes, we do have a lactation nurse, but all our nurses are trained in breastfeeding, and they continue the breastfeeding every day. A lactational nurse who's officially trained and labeled as a lactational nurse, she does rounds every day for the mothers, especially for all the mothers on day 1 and day 2. When she does rounds on day 1 and day 2, she tells them about the importance of colostrum, the correct positioning, latching on, because that is the time where they're very sensitive, mothers are very sensitive. So she does touches upon the importance of specific things. On day 3 and day 4, in the second round of counseling, she goes for the second round of counseling for the same mothers to make sure there is correct positioning and latching on. And now the mothers are more comfortable with her. So that's the time she tells them about the importance of hind milk and the maternal nutrition. So in our postnatal ward, this is how it goes about for all the normally born baby who are normal postnatal ward who stay here for 3 days. We make sure by the time of discharge, we make sure that the breastfeeding is completely started in the mothers, and then only the babies get discharged. Coming up to a next concept, new concept, or the concept which was not there, which we are not aware, is something called as the breast crawl. Sorry, I think some problem with the video. Okay, by the time I this one, breast crawl is one of the nature's way of telling initiation of the breastfeeding, which the baby herself crawls and latches onto the breastfeeding. Just give me a few seconds. I can see somehow the video got this one. So basically here what happens is the baby, once the baby is delivered and put on the mother's breast, directly on the mother's breast, and allow it to stay calm for half an hour to 1 hour. What happens here is the baby gradually opens up its, gradually opens. Sorry, I think the video is not coming up. So the baby suddenly starts spreading out its hands. And normally what happens, the baby has got the smell of the amniotic fluid in its hands. And the mother's breast also have the smell of the amniotic fluid. The baby starts recognizing this smell and starts moving its head towards the breast and slowly moves, crawls upwards and latches onto the breast. It is a very natural thing which has been observed, and this happens within half an hour to 1 hour. At this time, if we do not initiate breastfeeding, here the baby is very alert and active during this time. If breastfeeding is not initiated in this half an hour to 1 hour, what happens is many times what happens, it becomes very difficult to, for the latch on later, because afterwards both the mother and the baby go back to sleep. Sorry, the video didn't come up. So the other thing we normally do for, especially in the preterm babies, something known as the kangaroo mother care. All of us know kangaroo is an animal, especially in Australia, where it keeps its babies in its pouch, which is seen in the pouch, in its pouch, so that the baby is kept warm before and it is really ready to go out in the environment. Once the baby is ready, then only it lets go of its smaller one. Similarly, we do this kangaroo mother care. That is, we keep the baby against the mother's bare chest, as shown in the picture, with the head turned towards one side, with the hips in the flexed position in frog leg position, where the mother holds it for 10 to 20 minutes. It is again comfort of the mother for however long she can keep it, for as long as 20 hours to 21 hours if she is comfortable, she can help it. Lot of benefits, scientific evidence is there that lot of benefit is there of kangaroo mother care. Kangaroo mother care basically stabilizes the body temperature, decreases the morbidities, better neurodevelopmental, early discharge. That means it improves or promotes breastfeeding because of the bonding, and the mother also starts secreting more and more. It prevents infection, encourages the bonding in the mother and the baby. For the mother as such, lot of benefits. Again, increased breast milk production, improved bonding with the new baby, and more confident in handling the babies. Yes, kangaroo mother care is something which we are following very regularly, especially for preterm babies. And we have seen the impact also on the babies. Way forward, as I told you, milk bank is the next in thing which is happening in the breastfeed. Milk bank is a concept of introducing a very crucial element in supporting the breastfeeding and infant nutrition. It is basically an organization which is dedicated to collecting, screening, processing, and distributing the donated breast milk to the infants in need. So what we do here is basically there are four types: hospital-based, community-based, non-profit, or profitable. Basically, in milk bank, what is done is like the mothers who have extra milk or who have excess milk after feeding the baby, they express out the milk and donate it to the milk bank. Once it is collected from the milk bank, they screen the particular milk, like for all the diseases, like how we screen the blood. and then it is stored in particular temperature. And then whenever there is a need for the donor's milk, then it is supplied to the mother. Hospital based, there's something called as mother's own milk, that is we call it as mom. That means to tell if it is a preterm delivery or if the baby is sick, we are not giving milk for some reason. The mothers secrete out their own milk and store it for their own baby. They do not give it for someone else. The other concept is they give it for, these can be used for some other baby. Profitable and non-profitable means, yes, some are as a charity work, some are done as a commercialized. Milk banks are also available now. As of now, in our hospital, yes, we are in the process of getting our own milk bank. And meanwhile, we have a commercial donor's milk which is available. But the only thing is, it is very, very expensive. So benefits of these is mother's milk. Mother's milk is only given, so the baby still gets the benefit of all the breast milk, less infection, easily digestible. As I told you, limitation is they are very, very expensive. As of now, whatever is available, we have 50 ml of mother's milk, that is breast milk, which is available at the cost of 900 rupees. My experience as a neonatologist with preterms, we had about 6 months back, we had a 29-weeker who had a vigorous course in NICU, who was sick, encouraged his mother to pump milk. We started the Palada feed for the mother. Baby was on full feeds. The baby became sick again, and the baby was diagnosed to have patent ductus arteriosus, which underwent a major surgery. Luckily for us, the baby tolerated the surgery very well. By this time, the baby was 32 to 33 weeks. But as the secretions was less and mother was getting more and more frustrated of staying in the hospital and with all the mental stress she was undergoing, the mother was very, very adamant to start formula feeds. In spite of repeated counseling, we had to start the formula feeds for the baby. And unfortunately for us, in spite of the baby surviving such a major surgery, after 2 days of starting the formula feeds, the baby developed something called as necrotizing enterocolitis, and the baby expired. So it is a very disturbing moment for everyone, and it is the guilt for the mother that she started formula feeds. And unfortunate for all of us that this baby had to undergo this. And this is the reason many times we tell the preterm babies not to start on formula milk. And this is where our milk bag come into our help. One more baby, which was around 32 weeks, was very sick, in ICU stay for 1.5 months. The parents were very poor. They were financially drained out. There was a lot of difference of opinion among the parents. No in-laws support financially. Ultimately, it turned out that the father wanted to take the baby out of NICU, where the mother was not willing at all. So there was a point where the father left the mother in the hospital and went away because he was angry with the mother. And the mother was suffering so much that she actually had to skip her lunch and dinner. Every day she used to take one lunch so that she can save the money for the NICU and for the NICU caring for the baby. All of us sisters got to know about this, and the sisters started pitching in financially. If not directly financially, they used to get her lunch, they used to get her vegetables, fruits, everything, and they used to make sure that she's nutritionally doing very good. And with all the help from the doctors and the nurses, the baby luckily got discharged. The baby is 2 years now old, and the mother, we had to convince the mother to get back the father. The father was counseled 2-3 times. Luckily, the father and the mother reconciled. The baby is presently in Ramnagar, still on call. Which we had recently. This is probably some 1 month back. This was a 31-weeker preterm, 900 grams, which was sick on ventilator. Started on feeds. The baby was having full feeds. No weight gain. Mother's milk was not sufficient. Counseling was done regularly. Parents also counseled. Luckily for us, both parents were very adamant that there is no formula feed at any cost for the baby, and they were ready to wait till the mother starts secreting gradually. After repeated counseling for the mother and calming her down, making sure her mental stress is not there much, we made her come to the baby, sing for the baby, hold the baby. All that was done. After all that, both the parents took the baby home. The baby is presently not 4 months, 2 months old on regular follow-up and presently is doing fine. The reason I put up these incidences, you might be thinking this is common. Yes, this is common for us for a day-to-day in a NICU where we are seeing. There was three different scenarios here where I have put in, which has happened to us. In one, the mother, both the parents were willing, were very patiently they waited. Believe it or not, they waited for at least 15 days after the baby has achieved full feeds so that the mother gets enough feeds. After that, it is not easy for the parents to start and wait because financially it is quite draining for anyone in an NICU care. Second thing is financially, psychologically also it is very draining. The other thing is with the parents' support, with the parents and the surrounding support, environmental support, probably no mother will take a decision take a decision of starting any other feed other than her feed. Yes, the constant support. In the third scenario, the mother was confident because she had the support of her husband, she had the support of her mother. Whereas in the first scenario, a lot of other psychological issues were there where the mother became so frustrated that she had to take a decision of starting formula feeds. Ultimately, whatever said and done, it is the parents' decision, which we have to sometimes agree for it, and we have to go forward in spite of repeated counseling. I would like to end at the end of the thing. I would like to summarize a newborn baby has only 3 demands which a baby asks for. They are the warmth in the arms of its mother, food from the breast, and security in the knowledge of her presence. I think breastfeeding satisfies all the 3. And I think that is why breastfeeding has to be encouraged and with all the support and due recognition should be given for the breastfeeding. Thank you.
Thank you, ma'am. Thank you for taking us through basics of breastfeeding, myths about breast milk, gaps in the breastfeeding, strategies followed in our hospital, milk banks, and also your experiences in our hospital as a neonatologist. Any questions? So there are no queries. Thank you very much for this, for being present for this session, ma'am. We'll move on to our next speaker, Dr. Prashant R. I'll request Dr. Amoga Shri to introduce our next speaker to the audience.
Prashant Ranya Raghavendra. Sir is working as consultant senior neonatologist and lead in the hospital Bengaluru and also working as assistant professor in Indira Gandhi Institute of Child Health, Bengaluru. Sir completed his MBBS from JJM Medical College, Davangere. He secured gold medal in medicine as well as in OBG. Sir completed DNB Pediatrics from Lord's Hospital, Kochi, and fellowship in pediatrics, gastroenterology, and hepatology from Medanta, the Medicity, Gurgaon, and DM neonatology from Seth GSMC and KEM Hospital, Mumbai. And he also secured gold medal in his examination. He has given various talks, including in the platform like Doordarshan Television. He was a research member of Pearson Academy Research Project for Indian standardization of BSID 4 for Indian children. And he was a national level faculty for 6th neonatology refresher course by neonatology chapter of IAP and neonatology. He is having around 24 publications to his credit, and 14 are accepted and in press. He has secured various prizes in the conference for his research work. Over to you, sir.
Thank you very much for that introduction. Hope you're able to see my screen.
Yes, sir.
Okay. At the onset, I would like to thank JSS Medical College Community Department for providing me an opportunity to talk to this August audience. In fact, this is one occasion where we can use this word August and audience, because this is a very special thing. That is first week of August, breastfeeding week. Fine. Today, in fact, you all heard a wonderful talk by Dr. Sushma Madam, who almost, has covered many of the aspects of breastfeeding, especially in babies with special needs. I'm going to touch on a few more important aspects. Is my slide moving?
No, sir.
Just 1 minute. Yeah. Is my slide visible now?
It's visible now.
Yeah. So what we will be talking today is basically regarding how do we support breastfeeding in babies who have special needs, especially those who are sick. So this is something what we usually come across in the NICU every day, which is called as a sick baby dilemma, wherein the mother might not be prepared for this particular type of an eventuality. So when she sees the baby for the first time, she has a lot of questions regarding breastfeeding. How will I be able to breastfeed this baby? Should I be giving breastfeed for such a sick baby? Or if I give milk to this particular baby, will the baby be able to tolerate it? So what we generally follow is we have to always say that the milk that you are giving to your baby is the best milk that can be provided. In fact, for a preterm baby and for a sick baby, it is always MOM, that is mother's own milk, because we know this particular milk is not only apt for the baby, it is also species specific. A preterm mother will be able to produce exactly the same nutrient composition that is required for her ill preterm baby, and whatever is a nutrient composition that is specific for that particular baby is produced by the mother. In fact, currently there's a lot of talk regarding the gut microbiome, so the microbial quality of the breast milk in the preterm thing, which is appropriate for the gut of the preterm. Even when the baby is sick, she should continue to give breast milk for the baby. In addition to all these things, beforehand, the antenatal preparation is extremely important, wherein at the time of preterm delivery itself, we tell the mother that probably, when you go and visit the baby for the first time, you might see a lot of tubes, you might see a lot of, stickings on the baby, you might see a lot of infusions that are going. So don't be scared about it. Whatever the sickness is, your baby will be able to tolerate some amount of breast milk. So start expressing the milk soon after delivery. This much of anticipatory guidance that is given to the mother helps a lot. And once the mother comes to the NICU, we encourage her to spend more time with the baby. As you're seeing over here, kangaroo mother care is the best thing that can be provided, that improves the bond between the baby and the mother. We encourage her to come to the NICU, touch the baby, hold the baby, talk to the baby. All these things help in promotion of milk. In addition, we have a dedicated team or else the mother should be guided by a dedicated team who helps her in expressing the milk right from day one and continuing to express as long the baby is able to take. So if this is one image which we want to highlight over here, that the breast milk expression should start soon after delivery. So in fact, in the first few days, the first 2 days, the only thing the mother will be able to produce is the colostrum. Colostrum is called as a liquid gold, which has to be given to the baby because it is extremely rich in immunoglobulins. How much ever she is able to produce, probably 5 ml or 6 ml, that has to be given to the baby. What has to be done is just take the colostrum, paint it over the mouth so that the baby gets his or her first feed. Moment the mother starts expressing, first day she will be able to produce say around 4 to 5 ml, then 6 ml. The more she expresses, the more the milk output is going to increase. In fact, studies have shown if the mother starts to express as early as 6 hours after delivery, by the end of 2 weeks, she will be able to produce at least around 500 ml of milk. That is the importance of making sure that the milk expression starts as early as possible. Yes, initially what is advised is the manual expression of milk. But if the baby is supposed to be in the NICU for a longer period of time, the hospital grade as well as the machine graded breast pumps can be used for milk expression. So this particular milk is fed to the baby as per the gestation. Say we have a baby who is less than 32 weeks of gestation, we would prefer to give this milk through an orogastric or a nasogastric tube. If the baby is between 32 to 34 weeks, Palada feed or a Bondla feed can be tried. If the baby is more than 34 weeks of gestation, that is when we expect the suck, swallow, and breathing coordination to have completely developed, then the baby can be tried on breastfeeding. But whatever is the mode, we always have to make sure that we initiate some feed and we gradually increment the feed, and preferable milk is always mother's own milk. So if we are having this spectrum of disease, we do come across another category wherein the babies, these are all healthy babies, but the mothers keep coming and telling us that whenever I'm trying to feed the baby, there is a lot of noise that comes through the baby's nose. So this particular problem is something what we see in day-to-day clinics. This basically happens because all our babies, newborn babies, are obligate nasal breathers. So moment there is some kind of a nasal secretion, or this usually happens because of inadequate burping, where there is some amount of milk that gets regurgitated into the nose. The baby has a lot of difficulty and struggles a lot while feeding. This in fact makes the mother a little underconfident and feels that, okay, probably I'm not doing a proper job. Maybe this baby might not be able to feed properly. So something that is very simple that needs to be told here is treat the nasal block. Make sure that soon after feed, you keep the baby in, so burp the baby, keep in proper position. If there is a lot of secretions, the secretions or milk need to be cleaned, and always encourage and tell her to continue to breastfeeding. And especially in preterm babies, this is a bigger issue because the nasal passage as well as the oronasal aperture itself is small. So any small blockage over there leads to noisy breathing, which most of the mothers interpret because of either as a result of faulty feeding or the baby having a respiratory thing. So this is something what we need to re-emphasize. So in this particular image, we can see there is a whitish coat that is noted on the tongue of this baby. This is one more common condition, which is called as a thrush infection. So usually this thrush might occur when during the normal delivery, when the baby is passing through the vaginal canal, the baby might acquire this. This particular thrush can be passed on to the mother, leading to candida infection or nipple infection. The first thing we have to make sure is to differentiate it from the milk. So what we usually tell is we see where the coating is. If it is usually involving only the tongue, sparing the cheeks and other thing, probably it is milk. But you find that it is kind of persisting and also includes the tongue, cheeks, and the baby has difficulty in latching, it requires to be treated. The main thing over here to establish breastfeeding is it's not only making sure that you apply a gentian violet or an antifungal mouth paint to the inside of the baby's mouth, but also to the nipple, and always make sure that both the mother and the baby are treated. Following this, the baby can be put to the breast. If in case there is difficulty in latching, or if there is still a painful nipple, the mother can be taught how to express the milk and feed through a katori and spoon. The next problem what we genuinely face is mothers coming with this complaint of babies passing watery stool. In fact, if you see that it is a normal transition of stool that happens when the first stool what the baby passes is usually the meconium, which is sticky and green. Later on, the water content of the stool increases, which is going to become the transitional stool. Then we have the formed or the semi-formed stool. But what usually happens over here is a normal newborn stool should be soft. It is pasty, golden yellow, and it is odorless. However, if the mother feeds only foremilk for the baby, foremilk has a very high concentration of lactose and watery content. There is something called a gastrocolic reflex that happens, wherein as soon as the baby feeds, the baby is going to pass stool, and the stool continues to be more watery. So this is one condition wherein we tell the mother that, look, it's not only the foremilk that needs to be fed to the baby, both the foremilk as well as the hind milk needs to be fed. As rightly told by the previous speaker, we should always encourage the entire breast to be emptied. So that when the breast is emptied, first the baby will get the hind milk, first the baby will get the foremilk, then the baby will also get the hind milk. With this, both the thirst as well as the weight gain aspect is taken care. However, with both these conditions, whether it's a transitional stool or whether it is because of foremilk, we don't expect a lot of weight loss to occur. However, if you see a condition wherein the baby is being fed breast milk with something else, probably cow's milk or probably with bottle feeding, they have a very high risk of presenting with diarrhea. These children are generally sick. They might have fever or hypothermia, or they might appear sick. The main thing what we have to make sure in such a situation is to take a proper breastfeeding history. Again, ask the mother, what was the reason for introduction of formula? What was the reason for introduction of bottle? Try to address it first. Subsequently, give her breastfeeding advice. Tell her what is the correct technique. Explain to her what is the advantages of breastfeeding, and correct the dehydration of the baby, which includes continuing breastfeeding either directly or by using cup and spoon. In certain conditions, we might have to give oral rehydration solution if the babies are moderate or severely dehydrated. So next common condition wherein breastfeeding is kind of, there is a lot of myths regarding feeding is in neonatal jaundice. As you see, neonatal hyperbilirubinemia is one of a very common condition. In fact, more than 60 to 70% of term babies and up to 90% of preterm babies might develop neonatal hyperbilirubinemia in the first week of life. However, with respect to breastfeeding, there are two things. One is breastfeeding jaundice and breast milk jaundice. Breastfeeding jaundice usually occurs in the first week of life. This is enterohepatic circulation. Here, it is more to do with the breastfeeding technique, the amount of milk which the baby is receiving, and how frequently the baby is being fed. So in breastfeeding jaundice, all we have to make sure is the mother continues to breastfeed, proper attachment, proper positioning, and give her a breastfeeding advice, telling that you need to feed the baby probably every 2 to 3 hours. And once the baby is around 2 to 3 weeks old, you can switch back to demand feeding, and most of the jaundice recovers on its own. The other thing what we see is the breast milk jaundice. This is because of the inhibition of the glucuronidase enzyme that happens because of the breast milk composition. Again, there is no contraindication for breastfeeding over here. In fact, we encourage the mother to breastfeed more. So with increase in lactation, with increase in the duration of breastfeeding, this aspect is also taken care of. So to put it in a nutshell, breastfeeding jaundice as well as breast milk jaundice, it's not a contraindication. It is not a condition where the breastfeeding has to be stopped. In fact, we need to continue breastfeeding in these two situations. How do we tackle this particular thing? Early initiation of breastfeeding. Giving colostrum to the babies, as we already told, it's not only the immunoglobulin content. In fact, colostrum has also shown to increase the excretion of bilirubin. Exclusive breastfeeding, unrestricted or demand feeding, and if in case the baby has to be kept in the hospital for phototherapy, she can continue to breastfeed during the phototherapy and also give breast milk through hand expression and never to stop the feeding. Okay, so this is another condition, which is cleft lip and cleft palate. Again, in this condition also, there is no evidence or there is nothing to suggest that these babies should not be breastfed. In fact, we should develop certain special efforts that are needed to breastfeed these babies. So the main problem that is faced over here is for a proper latch to occur, we require a proper positioning of the tongue, the palate, as well as the nipple. We need a good negative suction to get generated so that there is no leak anywhere and the baby is able to suck. What happens in cleft lip and cleft palate? This particular suction pressure in the mouth is not generated, because of which the baby is unable to latch and unable to suck. So the main thing over here is we need to position the baby in such a way that the nipple forms a proper latch, which overcomes the loss of suction that is happening. So what we usually tell is always place the neonate in an upright position. Okay, I hope you're able to see the screen. Always try to place the neonate in an upright position as close as possible so that the baby's nose and the throat are higher than the level of the breast. This is also called as a dancer's hold or a dancing hold position. So when such a position is used, the nipple is going to involved in this particular area wherein there is a cleft, and that is going to act as a bridge to overcome the negative suction that is not getting generated. So if the baby is held a little up, wherein you have the nose and the throat above the level, as close to the body as possible, within this position, she can still attempt to breastfeed the baby, and the abnormality in the suction pressure that is getting corrected can be corrected using this particular position. The other thing what we usually use in such kind of a situation is something called as a Haberman bottle. Again, the Haberman bottle works on the same principle. See, whenever we are trying to feed the babies, these babies require a little bit more time for them to suck the milk in because of the abnormality in the generation of the pressure. So in this particular thing, we see the milk kind of flows into this particular chamber, and it can be used to regulate the amount of milk that is going into the baby. This particular nipple is a special nipple wherein the baby need not generate a lot of pressure to suck. So the initial thing what is usually followed is we can try the breastfeeding position, the dancer's hold, or we can use a Haberman bottle till the mother is comfortable. Later on, whichever technique the mother is comfortable in, the same can be continued with obviously a reference to a plastic surgery for an early closure of the defect. This third and the fourth important aspect is babies who are born with retrognathia or micrognathia. A typical prototype of this is the Pere-Robinson syndrome. Again, over here, because of this retrognathia and micrognathia, these babies might not be able to properly attach and properly suck. Presence of these babies also might have an associated cleft palate, which all makes the tongue to fall back. So in this kind of situation, again, a special breastfeeding technique has to be used. In fact, these babies can be fed with the mother adopting a supine position and the baby being placed on the chest. Other thing that we need to make sure in such a scenario is these babies are initially given, first we do a proper oromotor assessment. We see how is the sucking, how is the swallowing of these babies. Try with Pallada feed. And once the babies are able to take the Pallada feed well, we gradually transition to breastfeeding. But the main issue with these babies, what is usually seen is the hypotonia. So if you see a term baby as well as a preterm babies, the term babies probably will be able to hold the neck for at least around 10 to 15 seconds. However, a preterm baby might not be able to do that much also. So any kind of breastfeeding position in these babies should make sure that there is additional support that is provided to the head as well as the body. So what we usually encourage in these mothers is either a cross cradle position, wherein the baby head and the shoulder and the body is very well supported with one particular hand, and the baby is placed towards the mother's breast, so that this particular head lag that occurs is completely prevented, and this head needs to be supported really well. The other technique or other position that can be used for such babies is the football hold, wherein again the head as well as the body is supported with one hand, and the mother uses the same hand with the same breast to feed the baby, making sure that the hypotonia that is there with the neck muscles is taken care of. So if we have a baby who is hypotonic, could be secondary to babies who are having something like Perry-Robinson syndrome, or the babies who have trisomy 21. Two particular holds can also be tried. One is a cross cradle, wherein the head and the body is supported, and other one is a football hold, where we are going to feed the baby using the same hand and the same breast. Okay, if you see, this is another picture, which is again demonstrating the dancer's hold. The same hold can also be used for a baby who again has hypotonia that is involving the neck, as well as which can either be a flexor or an extensor neck hypotonia, wherein the baby's neck and the chin is properly supported with one hand, and the baby is latched on to the breast. These are certain modifications that can be used when we are especially dealing with babies who have tone abnormalities. Okay, see, the other condition is any baby who is going for surgery. See, it is in fact, a baby going for surgery, even though it is more of a medical as well as a surgical issues, feeding is an important aspect what we need to take care in such babies. So most of the surgeries, especially the gut-related surgeries, require nil per oral, or the baby's feeds to be withheld for a long period of time. This particular thing has to be prepared and planned. So we all know that if in case the mother stops to express the milk, or if in case the mother doesn't give her feed, there is always engorgement of breast that might occur. So whenever the breast engorges, there is something called as prolactin inhibiting substance that gets produced, which gives a feedback to the brain, telling that there is sufficient milk that is available, so do not produce any more prolactin. So this leads to lactation failure again, because prolactin is extremely important for production of milk. If this continues for a longer period of time, the mother might go into secondary lactation failure. So most important thing is to ensure here again that the mother continues to express. She expresses and donates to the milk bank, wherein the same milk is stored for her baby, which can be given again once the surgery is completed. It is extremely important to provide psychological support to the mother, because this makes sure that her lactation is not interrupted. So once the baby's procedure is done, once the baby is fit to be fed, the same milk can be given, and usually we avoid prolonged hours of nil per oral. One more thing to be stressed over here, same thing is what is conveyed to the anesthesia team. So if it is a baby who is posted for an elective procedure, we don't advise NBM for more than 4 to 6 hours, because keeping babies NBM for a longer period of time has also shown to increase the risk of gut-related abnormalities. So try to initiate feeds as early as possible. Make sure that the mother expresses and keeps the milk, so that the same milk can be used for the baby subsequently. The next thing is twins. Even though we all feel extremely happy when we see a pair of twins, for the mother it is a lot of additional work, and a lot of she requires more psychological support. The first thing she's going to ask is, will I be able to feed? God has given you two babies, so much of milk will be given to you so that you can feed both of them. That is the first thing what we say. Both the twins can be breastfed, and it have to be breastfed. In fact, it has been shown, if both the babies suckle at the breast at the same time simultaneously, there is an exaggerated sensory stimulus to the pituitary. So both the oxytocin as well as the prolactin hormone production is in fact doubled in such situation. So there are two important breastfeeding positions that are taught. One is again the cross cradle hold, and second is the football hold. As shown in this particular picture, she can keep both the babies simultaneously on either on both the breast, with both the baby's head as well as body very well supported. She can use a pillow on her lap and place both the babies simultaneously in the cross cradle position, or the babies can be kept in the football hold. So this is one technique that can be used. And in fact, we always tell them that even these two babies might not feed at the same time. One baby might latch and feed for 15 to 30 minutes, other one might take up to 45 minutes, but do not compete, make them compete with each other with respect to feeding. Let each of them take the same time, and always make sure that you empty the particular breast to that particular baby, and never try to interchange the breast. If you have fed to the right breast for twin one, make sure the right breast is completely empty before you feed the twin two on the same breast. So this has to be followed, and this has to be told. In fact, if we have a preterm baby with twins, sometimes, I'm sure this is I think what you would have what we would have faced even in the medical colleges over there, wherein once the twins are delivered, we might not have a relative to kind of take care of both the babies. The mother feels very incapacitated at that point of time. In fact, these, if there is a preterm baby who is twins, if the combined weight is less than 2.5 kgs, both those babies can be actually breastfed simultaneously, and at the same time kept in kangaroo mother care also simultaneously, so that the mother is more empowered, so that she can take care of both the twins at home. So coming to the final thing, this is again about preterm babies who are admitted and preterm and low birth weight babies. Again, we have to re-emphasize that the preterm baby should always be given mother's own milk because of its unique composition. When these babies are admitted in the NICU, we start something called as oromotor exercises, which in addition with non-nutritive sucking helps us to transition. So moment the baby, we all know that the sucks and swallow coordination, the sucking response or the sucking reflex and the rooting reflex starts by around 28 weeks and usually is matured by around 32 weeks. And suck, swallow and breathing coordination usually develops by around 34 weeks. So when we have a preterm baby who is admitted in the NICU, who is around 28 weeks of gestation, we start something called as oromotor exercises, wherein we teach the mother before each feed, she has to do a oromotor stimulation so that these babies can be gradually transitioned from orogastric feeds to oral feeds. The second thing what we usually teach the mother is something called as a non-nutritive sucking. So this non-nutritive sucking basically is we ask the mother to completely express milk from her breast, and we keep the newborn on the breast of the baby so that the newborn learns how to suckle. In fact, just this suckling at the breast itself, will help the mother in increasing the milk production, and the oromotor strength of the babies might improve. So in addition to all these things, as we already discussed, the expression of milk in the first 6 hours, expressing it every 2 hours, and feeding the same to the babies has shown to improve the mother's milk output and also reduce the risk of hypoglycemia in them. Again, for a preterm baby, to make sure that the head is very well supported, we use the modified cradle or the cross cradle position. And for the first till the 32 weeks of gestation, orogastric feed, 32 to 34, the milk can be expressed and fed using a cup and spoon. And beyond 34 weeks of gestation, these babies can be exclusively breastfed. So these are some of the situations wherein we find the babies will require special needs. So I once again thank JSS Medical College for providing me an opportunity to speak on this topic. I'll be more than happy to take any questions.
Thank you very much, sir, for sharing your experiences and taking us through about difficult needs, like even simple issues like block nodes to very special needs to like period Robinson syndrome, and also some of the neonatal surgical procedures, how to proceed with breastfeeding and all. Any questions from the audience? We have not received any questions in the chat box, sir. Thank you so much for joining us for this session. Thank you, sir.
Thank you very much.
Now, I request Dr. Amogashri to introduce our third speaker of the session, Dr. Renuka.
Dr. Renuka, professor in the Department of Community Medicine. She also serves as Deputy Controller of Examination, JSS Academy of Higher Education and Research, Mysuru. Madam completed her MBBS from Kasturba Medical College, Mangaluru, MD in Community Medicine from Karnataka Medical College, Hubballi, and PhD on topic feeding practices and nutritional status of under 5 children among selective tribal communities of Mysuru district. Madam has attended and organized around 56 training sessions and conference. She has presented around 14 papers and published 60 research papers. Additionally, she has completed 5 ICMR STS project and she authored around 4 textbooks. She is a member of several professional organizations, including IPHA, IAPSM, IAHA, CATCH, IAP, IMA, and also the Mysuru District Family Physician Association. Over to you, ma'am.
Hello. Can you hear?
Yes, ma'am, you're audible, ma'am.
Yeah. Thank you, Amoga, for the introduction and good afternoon to all and greetings from JSS Medical College, JSS Academy of Higher Education and Research. It's my pleasure today to share a few thoughts and a very unique experiences I had with respect to breastfeeding on the occasion of World Breastfeeding Week 2024. And I have around a dozen slides which I would like to share in this context. Yeah, it's visible. The next slide. Is my next slide visible?
Yes, ma'am, it's visible, ma'am.
Okay, fine. I think Dr. Sushma and Prashant has done a good job. In fact, it was very interesting to note and a lot of learnings that we had in the process. And I think just to end up, I have few thoughts to share. So I just called my presentation as a mixed basket. I thought I'll just share a few aspects with respect to the breast crawl. I think Sushma was trying to show the same video. But I think I would definitely share because that is one of my favorite videos that I was shown and that I also want the participants also to have a look. And then, of course, few aspects of antenatal, postnatal counseling, the father and family support, which Sushma said with respect to some of the family members having some differences and how things go wrong and the child becomes a victim. And then a few aspects of my own personal experience with tribes and the breastfeeding, the mental health and breastfeeding aspects, the working moms, maybe in the organized, unorganized sector, and a few aspects I think Sushma was mentioning about it, human milk bank and the recent few disasters which happened in our country and across even otherwise in general, how a mother should be empowered and given support to continue breastfeeding in those issues. And of course, the Olympics, which happened where we had athlete moms, giving time to breastfeed their babies. Okay, I think I'll just kind of play this. I hope I should be able to do this. Unfortunately, I think even I'm unable to. Amoga, can you give me any suggestion how to?
Ma'am, you can share the YouTube. You can share the YouTube.
I think.
Ma'am, you can share, play it in YouTube and share the screen, ma'am.
Okay, I think I'll minimize this screen. No, if not, I think since it's already quite a long time, I think you all can view that. In fact, it's there on YouTube. Just put breast crawl. This is a very nice, the video. I think it's from the UNICEF team and the BPNI Maharashtra. By Dr. Prashant, I think it's Prashant Gangal. Okay, so just put a breast crawl. I think the first video that comes up on the YouTube is this, and I think I watched this a decade back, and it is quite encouraging. And I think if we kind of share these videos with others, and including moms, to be, I think they'll be very comfortable and empowered to not feel that they don't have adequate milk. I think each of the participants, I think you please watch this at the end of the day. Okay, coming to the aspects of antenatal and postnatal counseling, I think the important of this aspect is that this is a learned behavior. I think to breastfeed is, I think, the only species on earth, human beings, we have to be taught like how to breastfeed. But however, I think if the learning happens at an early time during antenatal period, and in fact, I think I would suggest, like, when you have a nutrition chapter in the schools, also in the colleges, nutrition, health, the chapter when they talk about reproductive system and all those aspects. I think why can't they include this aspect? And I think if the children come to know about this at much early age, about the importance of the mother's milk and all, I think they would also be supporting as even fathers and mother-in-law and father-in-law, whatever it is. So I think this timing is, I have mentioned here, ideally starts in third trimester, but I think it can start much earlier than this. And the content should be information about it, and maybe a few demonstrations. There can be some props which can be shown, and to say like how to hold the baby and all those, and followed by Q&A sessions where they get to have any doubts. I think that can be cleared. So antenatal period offers a best time because she's receptive, and now she's only thinking about carrying the baby and then delivering and how to nurture. I think that's the right time. And we also need to encourage about even the father, as well as if at all there is, as Sushma was talking about, mother-in-law being the most difficult person to handle. I think if they also accompany, I think, that should be a kind of family involvement here, so that they get to know the right things. And of course, very difficult to convince, but I think a start should be made. And I think the present generations of new mothers and mother-in-laws and grandmothers, I think we all will be very receptive to the change, or the the research that has happened, and also try to change our thoughts, and ensure that the mother is comfortable, and we ensure that the baby does not get compromised in breast milk. So I think this is experiencing support. We need to, the parents, the would-be mothers and fathers, when they are there, I think when they get to, listen and try to clear those doubts. And I think that would be the best thing that they can learn from. And Sushma mentioned about the trained lactational counselors on site. It's possible, but then when they move away from the hospital after discharge, it's difficult. But there is always a technology in hand. The mobile connect as well as telecounseling offers an opportunity where they can get connected. And mainly importance with respect to early initiation, exclusive breastfeeding, continued breastfeeding with complementary feeding, and very important in today's world where I see these young moms, having the feeding bottle in their bags along with their cosmetics, right? So I think that this is something very hazardous. Flaunting a feeding bottle is not something we have to encourage, and it's not the last resort. It should not be the resort at all. We should just discourage bottle feeding. And helpline toll-free numbers should be available, I think, in India when you have a child helpline and all other helplines. A breastfeeding helpline is a need of the hour. And very recently, last week, I think Chennai Hospital, they launched a toll-free number where the moms, anybody who have difficulty issues with breastfeeding can call and they can get some input from them. So I think when she was talking about, I think very coincident and very, the apt situation she was trying to relate the pre-term baby which was delivered and how that the mother gave the top feeds and how the child succumbed. The same thing recently, only last week, you can see this, the Abbott company where, just a moment. The Abbott company was fined $500 million by the US court for allegedly hiding fatal disease risk of infant formula. So there was a mother who fed and, they filed a case against the company and it was a huge amount that the Abbott had to give. So this always carries a risk, and I think this should be an eye opener for all mothers that bottle feeding, and especially with preterm child getting these top feeds. And father and family support was already dealt and how important it is. And family does offer a supportive environment and respecting decisions. I think this something cropped up when I was just trying to make the content. Today's world, when mothers, I think in future we are going to have, and already the issues are there, when the mother kind of takes a decision that she doesn't want to breastfeed. I think the days are not very far. When such things come, I think we do have certain alternatives being worked out. Like she said, the human milk bank, where if it is a very authorized, established banks, we can have that. And for many reasons, she decides, because it is, I think, at the next slide somewhere I'll show you like how, being depressed, the mom is not able to feed, or even the mother's, inadequacy or those kind of mental makeup itself will, inhibit lactation. So in this context, I think respecting decisions is also very important, which may be an issue which might come in future. And providing breaks, I think the father and the families need to give them breaks when they are fed and they want to take some rest. And emotional support has to be very constant. And advocacy and encouragement, like she was telling, like, the mothers are, not comfortable, and they initially only they ask, like, if I can get to feed using a feeding bottle, right? So I think that this is a context when, all because like she was talking about the social stigma of not comfortable in feeding in the public. When I think that the fathers and the male gender, anybody in the society has to advocate this issue, talk in different forums, so that, they do not have that kind of, the opinions about breastfeeding in the public. So I think that should be some role which they can engage in. And of course, educating and, they becoming knowledgeable is very important, so as to know how to face the challenges and also know the benefits. And in fact, one of the study has also revealed that when there is a good paternal support and the family support, the duration of breastfeeding is also improved, and there is a decreased stress among mothers. And this is it about the tribes, the few a decade back when I did my PhD, it's just out of my interest, not in the interest of getting a PhD. It's just that I used to visit often the tribal areas. And that also made me interested in trying to explore, which I used to do informally. I then did a formal study there. And the tribes are there, they are very unique population, very adorable, very caring. They have their own practices, good practices as well as bad practices. And few things, if at all, they have picked up some bad practices. I think it's all from, sometimes from the urban areas and how we go about. So just to cut short, I think this image itself is so good to see, very healthy baby there. And then the encouraging practices was ever breastfed. Like my study, it said that 99.8%, almost all of the mothers had breastfed their child, and early initiation was done in 85%, and continued breastfeeding till 1 year of age, also close to 80%. And the adverse practices was like they were not exclusive breastfeeding till 6 months. They used to stop around 3 to 4 months and then continued the breastfeeding till 2 years. It came down to 30%. So this is like to correlate with whatever the indicators that we have. When I just went about doing the study, this is what I found. So there are good practices. This is only few images. I thought like, seeing is believing. So these are all few images, and you can see here, the bottle, the feeding bottle kept, and you can also see a small rent there, right? And this is a condition of the bottle, which the tribal people use because, they don't realize the importance of hygiene. And when I asked them, they said that, ili kadditu, that kind of thing, somewhere something has bitten and they have used the same bottle. And in fact, this is the family, this is a grandfather and the baby, the child who is there. And you can also, when close look, I think you can appreciate, that malnutrition also exists in them. And this is a kind of, this is all those same family members and the neighboring all sitting together and, having their kids with them. Some of the women, some community, the women don't go to work. So, that was very positive because they could take care of the child. And here you can see, the child having malnutrition because in the long run, when they're not fed, it leads to that. And here the grandmom taking care of the child. And then, this is one pic where you can notice, the feeding bottle. This is an aunt, the baby's aunt, who is holding, the bottle in her. And the mother of this baby had gone outstation. This is Hakipiki community, which I studied. There you see that the aunt was trying to take care of the baby, and she was holding the feeding bottle because mom is not in the station. So she was trying to feed this. And then this is a family which is a Jainapurba, which is a primitive tribe. But then look at the family, there's so much close knit, and the way the mom and the children are all together, and she's also feeding. So that was very encouraging to note. And coming to the mental health and breastfeeding, I think breastfeeding have protective effects against depression, especially the postpartum depression. But the challenges in breastfeeding, with especially to initiating the breastfeeding, especially when she's a first-time mom, it's so difficult, and she's so kind of not very sure, and feeling of inadequacy, lack of support system can contribute to depressive symptoms. So it can be like, breastfeeding, the act of breastfeeding itself can lead to depression. Or, if the depression, if a mother has got severe depression, she may not be in a condition to feed. And there are a lot of things that has to take. In fact, I, as a mother, the first time when I delivered, initiating itself was difficult. In fact, I delivered in JSS hospital itself. And it was so difficult. I was so uncomfortable. And of course, today you have these human milk bank. And, something that you can always see that you can feed that until the mom gets ready. But unfortunately, it was not there 2 decades back. And the worst thing that happened was my aunt who was there, she just got the cow's milk and I gave it to my daughter. So, see, this is something that we all have gone wrong somewhere, and we feel guilty even after 20 years. There are many things I don't remember, but I think this is something wrong that I did. And when we talk all this now, I feel like, yeah, even I did go wrong. But then I think there's a knowledge is power. I think we need to share this to the common people, and they also should realize, like, it's. And today's, if at all we are going to have this human milk bank, I think it's going to be something, a support for all the new moms as well. So in this context, I think addressing both breastfeeding and mental health, any mental health needs through comprehensive support system is essential for the well-being of both mother and the child. And coming to working moms, either in the organized or unorganized sector, education and support is very essential, not only to the mother, especially you can see here it's not only the women, she has to be prepared even before she delivers as to how that she's going to manage breastfeeding issues in the first 2 years of after birth. So, and also important here is the organizations, the organized sectors, maybe it is any of the institutions, the employers also have to be sensitized about the issues. And organized sectors do have these maternity leave for 26 weeks. And like they mentioned, there should be lactation rooms, not just a room to just express, but also a storage facility. and the mom should be given the breastfeeding breaks during the working hours, the crèche facilities which are there in the organized sector, which is good enough. And then there should be a flexible schedule, and also remote working options, which is happening in IT sectors where they can work from home and still be able to feed their child. I think here you can see a woman in the remote area still trying to be in front of her system and then still go about with her feeds. So this is all required because they only say the moment they become mom, like, she might quit the job. I think that should not happen. This should not be, this is very much to be normalized. And if she can continue her job, and I think the best part is she's always an asset to the organization, and the employer retention will always be good if they try to support her in the first few years of the child's growth. And unorganized sectors, especially the agricultural laborers, the daily wage workers, domestic workers, and the street vendors, I think this is something has to be addressed. Maybe like Sushma was talking about the non-profit organizations coming with express breast milk where they can store, and where you have an access to get even free of cost if it is non-profit organizations who run, so that the child can be fed in absence of the mother. And coming to human milk bank, I think this is a new concept that is coming up. Unfortunately, it is not there. Even in Mysore, I just recently contacted the government hospital here. They said that, in fact, there was a paper, the article telling that the Mysore is going to get its human milk bank. It was published on, I think, in February 2024. And when I asked in August, they said, ma'am, we still need 1 year. So I think when other things can roll out so fast, establishing human milk bank is at most important, like a blood bank. I think this thing is still not being driven into the government, the policy makers. So I think this we should be able to have as many human milk banks as possible in various contexts. So this is a very advantage because the whole thing is in such a way that the storage collection happens, the screening happens, the pasteurization, the storage happens, and it is dispensed by the doctor's prescription. So I think very, very organized way to ensure that for the future moms as well, that this is made available. And this is very important with respect to the low birth weight, the moms who deliver the low birth weight post cesarean section, abundant child, and mom who doesn't want to feed. I think this is something which came to my context, and this may be a need in future. Okay, so this like, I think this asana which I just want to just tell about what it meant. There was a mom who was not able to feed in the first few days, and then later she just got some help, and then there was a donor milk which she gave it to a child, and later she could establish the milk. By then it was so much good, and then she realized that the importance of expressing the milk, and also she realized like she also can donate milk. Okay, so that's a way like how things can get translated. And we hope like each district and even sub-district levels, we start having these human milk banks in future. And there are notable milk banks in India, across India, in Mumbai, Delhi, Udaipur, Pune, Delhi, and in Bangalore, the Vanivilas Hospital has got its human milk bank. And this is just an image, in kind of what was known as wet nursing in the past. Which was there until 20th century, but later on it faded away. There were a lot of reasons for it, and this is the King Louis XIV, who was wet nursed, and because they always had the feeling that when they nursed, that their figures would change, and they were not able to carry out their household chores. That is how that some of the people who could afford had these wet nursing. But then there were a lot of stories behind that, the wet nursing, because they could get some money out of this. They used to leave their kids back home and start working. There are a lot of issues that happen. And the human milk bank is something, a concept which has come up. I think that has to be encouraged. And always, like Dr. Prashant was telling, it is species specific. Human milk is for human milk, and the cow's milk is for the calf, right? So giving this, the human milk itself is like, taken from the human milk bank. There are fewer infections, decreased weight gain, and even the IQ is good when you're giving the species specific milk, and the prevalence of diabetes also will be low down when you give species specific milk. And coming to disaster and breastfeeding issues, I think recently also we had this happening in Kerala and anywhere across the world. I think the importance of breastfeeding should be there, and the system has to ensure that the mother who is feeding is transported safely to a safer place, and she has to continue breastfeeding, and ensure that at no cost that those formula feeds, those packets which are thrown, she must not get into that, and be assured that she can still feed in amidst all these issues, whether it be rain or shine, whether it is issues in the desert or in area where it is flooded, because she should have the confidence that the milk that she is secreting is adequate. And of course the Olympics, which we all know, like, and the one thing, the best thing that has happened this time is 24 Olympics. All the elite mom elite, it's called an elite sport, and all the athlete moms who were feeding had the opportunity to have a nursery very close to the Olympic village, and there was a childcare center where in between their practice events and during their the final anyway track or off track events, they could go feed and then come back, and there were even people, some of the organizations who volunteered to send volunteers to take care of these children, and there were provisions even for the family to come stay there and ensure that the children are taken care. And almost to conclude, this is only a recent visit I made in Bangalore. It's called the Model Village. Very interesting. In fact, I strolled there for almost 1.5 hours. Very interesting. The life-size models that are being kept, and the settings. It relates to all Karnataka, right from north to south. You can see like how spontaneous it is. And just a moment. Yeah. So you can see here, the mother is lying down and she's got a baby here and she's feeding, and it's so spontaneous, right? The other members are just doing their job. There is nothing that she has to hide about it. And here is another child, little grown up, and she's trying to, the grandmom or somebody is feeding that. And here it's that same house. In fact, I took another picture here. The mom who is put the baby in the cradle, and she's very comfortable. And you can see here there is an elder member of the family who is on his own, and there is other members who are busy doing their job, but the mom is sitting very comfortable and feeding the child. And of course, this is something very could relate, because this is how we give birth to the babies, and everything is so spontaneous here. There's nothing, to be having any discomfort about. So this is from my side. I think the take-home message is, let's normalize breastfeeding. It should not be something, a very issue to be spoken about. Let it be normalized. Let every stakeholder, right from children to the elders, they should know that this is something all of us should relate with. And I think let us all work towards, ensuring that we have no confused mom, but a more comfortable, empowered mom who can feed her child fully. And yeah, I think the last thing that I would always, I think this is a platform, maybe of course no policymakers or stakeholders are there, but I think we need to, like how we have universal access to health and all that, I think universal access to human breast milk is something that we all should look forward and see that no child is deprived of human breast milk. Thank you.
Thank you very much, ma'am, for this enlightening session and for emphasizing on the importance of inclusion of all, including the family members and the fathers, in the breastfeeding journey, and sharing your experiences in tribal population, importance of mental health, and other policies regarding milk bank and other things. Thank you very much, ma'am. Any queries? Ma'am, there is a query regarding what are the guidelines to start breast milk bank. Ma'am, you are not audible.
Sorry. Currently, the guidelines is basically like one is Sushma said, like it can be from the governmental or non-governmental, profit making, non-profit making. There are guidelines. Like I think I showed up this previous thing. Just a moment. I think this is a document which I think you can just refer to. It's a very well documented, very recent, 3 years back, minimum standards for establishment and operation of human milk banks in Southeast Asia. I think this is one which the countries in Southeast Asia are following up. And currently, like most of the things are all either the government or the private hospitals which are coming up, and few voluntary organizations. I think they need to go through those documents and take approvals, those checklists that they have to clear. Only then they'll be able to establish. And based on the facility or the infrastructure that is available, approvals have to be obtained, and only then it's possible.
Ma'am, there is another query regarding stored breast milk can be used for how many hours?
Stored breast milk, I think if it is, if I think around 2 to 4 hours, if it is kept in the room temperature, it can be used. And if it has to be used after beyond that time, it has to be, it has to be stored in the refrigerator. And it can be again thawed. I mean, get back outside, keep it at room temperature, thaw it, and then again it can be given. And the thing is, it should not be boiled or like what we do for our everything, we keep boiling. No, I think there's an indirect way how you can bring that temperature. You can keep a small vessel, keep little hot water, and then keep this katori which has milk in that, and then try to bring it to normalize the temperature, and then it can be given. I mean, this is my kind of knowledge that I have. Beyond this, I think one is it can be kept at room temperature, and little beyond that, definitely that is why they say that that there should be a storage bank, storing facility even in the workplace where it has to be stored, not indiscriminately kept outside. Because as you know, milk is something which can get spoiled, and if the milk is getting spoiled, means it's natural. Like how you know that artificial other milks will not spoil. So if it is natural, definitely you have to store. Refrigeration is must.
Yes, ma'am. Adding on to that, if I'm not wrong, we can store the milk in freezer for up to 3 months.
Exactly. Yeah. Even the freezer aspect also. So it based on the facility, I think they can upscale it and keep it. But if it is a normal domestic at family, and if the mom is going working, I think she can keep it in a fridge and then go. But if it has to be kind of it's a need for many people, I think this freezing it can be kept in the freezer and then thawed, and then it can be processed.
Ma'am, the next question is, any
Yeah.
costing studies done with regard to establishing milk bank, because it is essential before setting up one?
What was the first part of the question? What?
Any costing studies done, ma'am, with regard to establishing milk bank?
But I think the milk banks itself is a very few which have been established in our country. So when it comes to that, I think those kind of studies may not be there currently. And most of the things are all operated by the organizations who are already in different domains, and they come forward to establish this.
Okay, ma'am. Mr. Vishwanath Prasad, he has
cost-wise, I think when the government is going to get, I think the cost should not come into picture as well, because this is something, an investment which pays its dividend. So I think that in that context, I think for the government at least, they should not think in cost-wise.
Okay, thank you, ma'am. Thank you for the answer. And Mr. Vishwanath Prasad, he has shared a PDF link of human milk banking guidelines. I hope the participants can make use of it. So, any other queries? Thank you, ma'am. Thank you so much for being present for the session and enlightening us with your knowledge.
Thank you, Rashmi.
Thank you, ma'am. Participants, please note that this recording will be available in our YouTube channel, Chetana. The link has been displayed in the chat box and feedback forms have been displayed in the chat box. Please note the certificates will be provided only to the participants who have logged in today and filled the feedback form. Please note and fill the feedback form in the exact manner how is it asked, how it is asked, and our recording of this session will be available in our YouTube channel, Chetana. As we come to the end of today's program, I, Dr. Rashmi S., Senior Resident, Department of Community Medicine, take this opportunity to propose the vote of thanks on behalf of the Department of Community Medicine, JSS Medical College, Mysore. I express my heartfelt thanks to our principal, Dr. Baswan Gaudappa sir, Vice Principals, Dr. Suma and Dr. Praveen Kulkarni, and our Administrative Officer, Sri Satish Chandra sir, in their absence for their constant support. I thank our HOD, Dr. Sunil Kumar D, for his constant support in all the activities, and I also thank our staffs, postgraduates, and non-teaching staffs for helping us in successfully conducting this webinar. I thank JSS Academy of Higher Education and Research for providing all forms of support to conduct this webinar. Last but not least, I thank all our speakers for sharing their knowledge and our delegates who have joined us today from across the country for their valuable time and insights. I conclude this webinar by a quote: breastfeeding is the foundation of lifelong health. May you go forward with knowledge and confidence, making each day a step towards better health. Have a great day. Thank you.